Okay, so what I understand is the pluripotent cell will differentiate into insulin-producing cells. So how does the EPSC help in managing type 1 and type 2 diabetes?
Well, type 1 and type 2 diabetes is two totally different things. Let's start with type 1 diabetes. About 10% of the population of diabetic patients suffer from type 1, 90% suffer from type 2 diabetes. So in type 1, what you see is a autoimmune response of your own immune system attacking the insulin-producing islets in the pancreas. And once they are destroyed, no more insulin is released and patient turns into a diabetic. Actually, it needs only 75% of destruction of the islets, and then you start becoming glucose high and insulin dependent. So in that case, what we do is we have one specific immune regulatory cell which can eliminate those autoaggressive T cells which attack the insulin producing cells in the pancreas. And that helps to balance the immune system, and so the autoaggressive immune effector cells are kicked out, depleted, and then the islets have a certain chance to recover. That's what we stimulate then with stem cells. Okay. In type 2 diabetes, it's much more complex because the factors which contribute to type 2 diabetes are to some extent well understood, to some extent not really clear. We know that our lifestyle, by eating a lot of sweets and carbohydrates, can cause quite a sort of inflammation in our body. And this inflammation, by building up fat tissue, is then contributing to immune activation, and that lowers the insulin that increases the insulin resistance, which means in type 2 diabetes, the patients, they produce insulin, but the insulin cannot bind to the receptors in the liver and in the muscle. And if it cannot bind, it cannot bring in the glucose from the blood into the tissue, and therefore the glucose is high. Now what we have to do is we have to bring down the insulin resistance, that insulin can bind properly and glucose can go into the cell. And that is what we actually do with the stem cells, but also with quite another complementary treatments. We bring down the acidity in the body. We detox the body from heavy metals. We balance the microbiome in the gut. And we balance the necessary hormones, which also decline as much as we age. And you see, as such, it is a much more holistic approach, not only based on stem cells. Okay.